How does bone conduction testing measure inner ear hearing? Imagine trying to hear a sound that skips the usual path through your ear canal and middle ear bones. Bone conduction testing does exactly that by sending vibrations directly to your inner ear. This test works by placing a small device called a bone vibrator against your skull, usually behind your ear on the mastoid bone or sometimes on your forehead. When turned on, the device converts sound into mechanical vibrations that travel through the bones of your skull. These vibrations reach your cochlea, which is the sensory organ inside your inner ear responsible for hearing. Because the vibrations bypass the outer ear and middle ear, the test isolates how well your inner ear can detect sound. During the test, you listen for these vibrations at different pitches and volumes. You tell the audiologist when you hear the sound, and the softest sound you can detect at each frequency is recorded. This helps determine your inner ear's hearing sensitivity. Bone conduction testing is usually done alongside air conduction testing, which measures hearing through the normal pathway of sound traveling through your ear canal, eardrum, and middle ear bones. When the results are compared, they help identify what kind of hearing loss you might have. If your bone conduction thresholds are normal but your air conduction thresholds are worse, it suggests a problem in the outer or middle ear, called conductive hearing loss. But if both are similarly affected, it points to sensorineural hearing loss, which involves the inner ear or auditory nerve. The results are often shown on an audiogram, a chart that plots both air and bone conduction thresholds. An air-bone gap on this chart indicates a conductive issue. From a physiological standpoint, vibrations from the bone vibrator cause movement of the cochlear fluids, stimulating the hair cells inside the cochlea. Recent studies highlight that fluid inertia inside the cochlea plays a key role in how we perceive sound through bone conduction. This testing method is safe, painless, and non-invasive. It provides crucial information about the inner ear's ability to hear, helping audiologists diagnose the type and severity of hearing loss accurately. Knowing whether the problem is in the outer, middle, or inner ear guides treatment options, such as hearing aids or surgical procedures. In essence, bone conduction testing acts like a direct shortcut to your inner ear, allowing specialists to understand how well your cochlea is functioning without interference from other parts of the ear. If you're concerned about hearing loss, always consult a healthcare professional for personalized advice and thorough evaluation.